Hi, I'm Dr. Elisa Kolva, and I'm a clinical psychologist at the University of Colorado Cancer Center. I want to join UC Health in thanking all of our cancer caregivers. We know that a cancer diagnosis doesn't just impact the patient, it impacts the whole family, the whole system surrounding the patient. Our caregivers often help to carry this extra weight. This is very stressful. One of the reasons caregiving is particularly stressful is that our caregivers often experience a shift in or expansion of their roles with their loved ones. Rather than solely being a partner, a parent, a caregiver, or a friend, caregivers are often responsible for managing transportation to medical appointments, attending these appointments and asking questions, shopping, preparing meals, managing housework, giving medications, and assisting with other care practices, in addition to providing emotional support. Our caregivers become medical professionals, taskmasters, financial managers, schedulers, and more, and this can lead to additional distress. This distress has both physical and psychological consequences. Our caregivers often report poor sleep. They experience changes in weight, either weight loss or weight gain. This often results from changes in appetite. They have trouble engaging in self-care activities. They tend to exercise less. Caregivers are often less likely to tend to their own health while providing care for others. And this can lead to an increased risk of cardiovascular disease and other poor health outcomes. Caregivers often also experience symptoms of anxiety, depression, social isolation, and financial stressors. Now, most of this is not news to you, but the question is, what can you do about it? Given these high levels of distress and increased demands placed on the caregivers, we know that self-care becomes particularly important. However, and I hear this from caregivers all the time, it can be frustrating to hear that on top of everything else that you're doing, you also have to find time to take care of yourself. I want to talk a little bit about a few things that might help and might be more easily integrated into your routines to help you to take care of yourself. We often use the metaphor of the oxygen mask in discussing self-care and caregiving. We want you to put on your own oxygen mask first before assisting others. One of the things that can be helpful for caregivers is to take mini breaks. This can take anywhere from a few seconds to a few minutes, but taking that time for yourself can be very important. You know, that might involve just stepping outside for a minute to take 10 deep breaths or notice the weather. It might involve, driving an extra lap around the block before pulling into your driveway, or just taking the long way home. Turning up the volume a little bit louder when a song that you like is on the radio. We want to encourage you to practice asking for help. This is a very hard thing for caregivers to do. You've probably had friends or family members say to you, let me know if there's anything I can do to help. And it's hard in the moment to come up with something. So we want to ask our caregivers to take some time in advance to make a list of things that others can do that might be helpful. Now, we want to be mindful during this pandemic, but I think you can identify things that don't require close contact. Things like asking a neighbor to mow your lawn after they finish with theirs, or asking a friend to pick up a few things at the grocery store and drop them off on the porch, or something like picking up a prescription so you don't have to. That way you can spend time doing the things that really only you can provide to your loved one. We want to also encourage you to find ways to reconnect with other important roles. So those roles that tend to be neglected during caregiving. Find time to be a partner, be a child, be a parent. Do some of the things that you used to enjoy before your loved one's diagnosis. purposefully watching a movie or taking a walk around the block. Now, caregiving has been complicated by the current global pandemic. A caregiving team may be composed of a constellation of loved ones and family members, both near and far. And during the best of times, this can allow for more support for patients and caregivers. However, the pandemic has changed things significantly. Often families are separated by distance, and this can cause conflict and tension between those who are in town and those who are out of town. Furthermore, many of our patients are at higher risk, and thus close contact just isn't possible anymore. And this can exacerbate many aspects of caregiving distress. A few tips for caregivers who can't physically be with their loved ones during the pandemic. Make time to check in with the caregivers who are local and be creative about finding ways to support the caregivers who are in the home. And ask them how you can be most helpful to your loved one. Scheduling virtual visits can also be helpful. So much of our life has transitioned to the virtual realm, but scheduling regular check-ins with your loved one can just help both of you to feel that love and care. You don't always have to have a deep and meaningful conversation. It could be just checking in, sharing a joke, watching a show together, but just taking time regularly to make that contact. And during those times, it also might afford an opportunity to the local caregivers to engage in some self-care. We want to encourage you to observe your emotions. It's important to recognize that this is extremely difficult. This pandemic has limited our traditional means of coping and connecting with others. So know that it's normal to feel sad or anxious or overwhelmed. We want you to continue to engage in self-care. There may be an impulse to be harder on yourself since you're not physically around your loved one. But we want you to stay as healthy as possible so that when we are able to be together again, you can be there for your loved one. It's important to do your best to maintain your routine, and this includes engagement in the things that you do to help you feel good, to nurture your physical and mental health. We want to encourage all of our caregivers to take note of their support network as well. Friends, family, coworkers, and other caregivers. Here at UC Health, we have a fantastic support group composed of caregivers who can really offer the best kind of support to others who are going through this process. It has transitioned to being held online due to the pandemic, so it can be accessed from your home, phone, or computer. And also, please don't hesitate to reach out to our supportive oncology team or visit our website for additional information and resources. And to our caregivers, thank you again. Your care and dedication make our jobs possible.